Fortunately, we have no conflicts. So we are both honored and excited to be here and a little bit chagrined about the three of us being able to pick the top social emergency medicine papers of 2017. Like, how do you even approach that when we tried to spread broadly the social determinants of health over all of the patients that we see in the emergency department, both what brings them in here, into the ED, and also to follow them out. So we tried to be a little bit systematic. Well, Harrison tried to be a little bit systematic. So he did a search on some keywords as a start. But then also we really wanted to include some of the fundamental papers that talk about, you know, social determinants of health and their influence on populations. And so we also wanted to address vulnerable populations and look at collaborative projects and programs that might not necessarily have the keyword emergency medicine in the title, and also which might not address some of the material social determinants of health, but other determinants such as place, violence, stress. And so basically this ended up being a search based on widely reading, idiosyncratic reading of the literature by all of us. We ideally then would have come up with a list of articles and solicited to a wider group, but we ran out of time. So we would welcome your input, and we make no pretense to be complete. So we did try to look at different categories of consideration, and most of the papers that we list in our top 10, which are actually 13, cover a variety of these categories. So obviously topical, we'd look at housing, hunger, guns. We looked at methodology, different exciting ways of looking and doing these different analyses, geospatial analyses, cost-effective analyses. We did need to also look at tools that are available for us to do our work. So quality indicators of community health care, standardized screening tools. We looked at the different types of studies. So, you know, RCTs might be the gold standard, but I myself like pilot, innovative little studies. Also population-wide epidemiologies. And then different approaches. So we have some articles in that talk about the role of education's responsibilities in social emergency medicine, advocacy, in addition to research. So I think with that, I'm ready. Jahan?